there are a lot of challenges that people just working in government and work in public service have, that really brands have found solutions for in terms of cultural communication. And this is, I think, a perfect opportunity to invite Dr. Myles to speak a little bit about his experience in the early days of the pandemic. Can you tell us a little bit, Dr. Myles, about what it was like for you, and the difficulties in communicating with the people for whom you're responsible, about the importance of social distancing, mask wearing, and the medical mandates?
Sure, sure. So of course, being in this particular space, I work with pretty much a lot of the low income residents here in the city of Albany, in Albany, Georgia. And so, of course, when you dealing with that type of population, a lot of times they lack resources, and the perspective on from them is rather low. So they're not, I guess, revered as, and I hate to really put it this way, but a lot of times they're overlooked, right? So when people are making decisions and coming up with ways to make communities better, a lot of times low income residents are the last on the totem pole that people tends to look, you know? And so with that said, when this pandemic hit, literally now I service over 2,500 people. So that's a large quantity of people as it relates to the population here. And I have one particular senior tower that has about 100 or so residents literally in one building, right? And it's all senior and disabled citizens. So when that pandemic hit, something new, unplanned, I mean, it sent us in a scramble. So the first thing I did, I started looking towards our city leaders, our community leaders, to say, hey, what's the best way to deal with this? So I went to the Department of Public Health. I went to the mayor, because the mayor had put together a council. I went to our fire chief, police chief, everybody, because they was also again a part of this council. And pretty much everybody was telling me, okay, well, you know what, Dr. Myles, you just got to figure it out. So if you can kind of put yourself in my shoes for a minute, being responsible for that segment of the population, right? To where, resources are already limited now. And literally we was unprepared for this. And now I'm left to literally say, I got to figure this thing out, because unlike the city, you do have resources that I don't have. You have touch points that I don't have. You know what I mean? And so for me, it was strenuous. It was nerve-wracking, to some degree. But literally, I had to step into action, because at the end of the day, a lot of people depended on me to make good decisions. So we had to put a plan together. And one of those biggest plans was, okay, how do we get residents the needed services in order to keep them safe? And I'm gonna be honest with you. One thing that we did not consider initially was the communication piece. You know what I mean? We thought about the basic needs: food, shelter, water, any medical supplies, that type deal. But the most important piece was communication. And because sometimes it's not tangible, it becomes overlooked. Because you can have all the food that you need, you can have all the water, the shelter, it can be readily available, right? But if you don't know it's available, it becomes a moot point. And so how do you connect that dot? And so, man, literally, with that group of folks, man, we had to put a plan into place, and literally just start from scratch and putting things to make sure, that people, had everything that they need. And so what we did was start calling individuals one by one, just calling. Now, of course, with that many residents, that become very time consuming, and that's a hit or miss, right? So I don't know how effective that literally was, just to be honest with you, because it's so time consuming and it's hit or miss. And then again, the population that I serve, everybody don't have, the same type of equipment. Some people have cell phones that changes. Some people have landlines, So how do you, and we were accustomed to handing out flyers. Okay. So of course that went out the window. So coming up with the plan that included communications was critical. We were able to do some basic things in the forefront, but it wasn't until I ran across these gentlemen here that allowed me to be able to take what we were doing to another level. Because not only were they able to kind of bridge that communication gap for the residents that I serve, but it served as a catalyst an example for the other community leaders. Because once I literally put my plan in place, I shared it with the Department of Public Health. I shared it with the medical doctors here at Feeble Memorial Hospital. I shared it with that leadership council that the mayor put together, and they loved the plan. They was just like, we don't know what that young man is doing over there, but I do know what he just presented. He's doing the right thing. So we need to follow his lead. And so that absolutely made me become astounded at what we were doing, letting me know that we're at least on the right page, we're moving in the right direction. And so when I met these two gentlemen who first and foremost did not come to me to sell a product. Now, that's the one thing I loved about it. He did not come to sell a product, did not come to even talk about, per se, a product or anything relative to that. They wanted to know what were the issues I was going through. What were some of the hurdles and the obstacles? I had no idea that it was going to lead to communication. It was just more so, what are the needs? Because we know that Albany is a hot spot now. It's a hotbed for COVID-19. How are you maneuvering through that? So just having conversations and being able to relate to Imran, and to Beckett on that personal level, that made me feel good to say, okay, well, these guys, they really about community. They're about community building and helping people. How can we forge a relationship? And as we begin to talk, and I don't think Imran knows this, but when my first communication with him, I was literally in my truck. I wasn't even in my office. I was in the parking lot in my truck, and we was having a very candid conversation. It was very, because I shoot straight from the hip. It was very candid. It was very straightforward. He asked me a series of questions, and I told him my honest opinion. And a lot of it was due to me being in this thing and feeling like I'm alone, right? And so after we finished that conversation, he said, well, look, I think this is what we propose to do. What about building a communication strategy that will literally save a lot of time, effort, and energy on the agency's behalf, and it'll literally connect your residents with much needed information to keep them safe? Because everybody's going to Facebook, everybody's going to Instagram, and who knows what's happening on those social media platforms. It's only making it worse for me, because now I have to go and dispel all the myths that they have now heard, and I have to go and set the record straight. But we're talking about 2,500 folk. How can I do that, and it not be so time consuming? And that's when these gentlemen came and they say, hey, look, we can do X, Y, and Z. We can work with you, your team, your residents, to make something that's unique for your particular agency. And I was just, I was blown away. And so I heard them out, I listened, and then the next thing I did, I took it to my team, got their input, got their thoughts, and they were just like, and again, I'm more progressive, here is more conservative. They were literally like, oh, wow, well, Dr. Myles, we're not quite sure on where you're going, but whatever you're taking us, we're along for the ride. I mean, definitely. And they jumped on board, and I introduced them to the team, man, and they literally put together not only a communication strategy, but, man, the actual product. When they introduced us to You Go Round, when they put together a video that encompassed the heart and the culture of this city, right? And it literally went from the residents of public housing downloading apps and becoming more in tune to information. The whole community started asking, hey, what's going on? We want to get that information too. And it's like they started downloading the app. They wanted to be more in tune because they felt like, hey, this information is real, it's true, because everything was fact-based. Everything had supporting documentation to say, hey, this is what it is, this is what makes it real, and this is what the other platforms do not have. And because of that, it began to shape this community, and so definitely I'm very grateful to that, because again, it just created another avenue for me to communicate in a real way, in real time, with the residents that we serve. And Imran and Beckett, you don't know this as well, but I literally just got off a meeting this morning, and I was talking about, our relationship and what you guys had brought to the table for us. And now, and this was at Gara. So we had a committee meeting at Gara, and literally everybody wants me to introduce you guys to them because they want to implement the same thing there that we implemented here. And I literally just told them, I explained to them about it. They was like, this is exactly what we was needing. I said, well, actually, I was going to CERC with it. We're slated to go to CERC. And they said, no, do not go to CERC without coming to us first. We want to have first dibs. Do not tell the region, tell the state. So literally, they want us to do a presentation as it relates to that because there is such a need in public housing authority to communicate to these residents and communicate in a real way, in real time, and factual information. So that alone, I'm
That's
telling you,
fantastic
speaks
news.
volumes for what we've done here in Albany.